I'm Albert Wu, and I'm a professor of health policy and management.
What motivated you to focus on these areas?
I got into patient-reported outcomes through research that I was doing on finding effective drugs for HIV/AIDS. I participated in really just about the first randomized control trial ever for a drug for HIV, that was AZT. I realized that people who were on the medication were not doing necessarily that well, even if their immune indicators were doing better. And so I wanted to measure their outcomes from their perspective, or what we call quality of life. The other thread was that I got interested in patient safety. We didn't call it that when I started, we called it medical errors. I was actually searching for something to propose to do for a fellowship that I was applying to. And I realized that not much had been done about how medical errors were handled in medicine. And so that was the start of that.
Was there a pivotal experience or person that inspired you to do this work?
Um, in both cases, I was inspired originally by experiences that I had working. I was very fortunate to have some amazing mentors. For patient-reported outcomes, I was fortunate to be able to work with three of the most influential early researchers in the field: Bob Kaplan, John Ware, and Marilyn Bergner at Johns Hopkins, who recruited me here. And for patient safety, I had early experiences myself personally and also working in healthcare about the really devastating consequences that medical errors could have. But in my fellowship, I again had a great trio of mentors: Bernie Lowe, Steve McPhee, and Susan Folkman at UCSF in Berkeley.
What impact do you hope your research will have?
I hope it'll influence healthcare providers, the organizations they work for, and at least some of the time I hope to have some influence on health policy. So I hope that people think more about the patient perspective when they're taking care of people or doing research. Certainly hoping that healthcare is safer for everyone every time anyone gets healthcare. And I hope that everyone becomes more aware up and down the whole system of healthcare that patient safety should be a top priority.
What insights has your research given you?
Back more than 25 years ago, I had the insight that doctors and other people taking care of patients could be traumatized, could be harmed by the same adverse events that harmed patients. Both were victims, in a way, of systems that were not well designed. And I thought that you could consider clinicians to be second victims of those incidents. That has caught on, and I think is now in common use in healthcare in general. And I was surprised but gratified to see that those ideas had so much influence.
What's your favorite course to teach?
Perhaps not surprising, I've got two favorite courses. One is on assessing health status and patient outcomes, how to measure quality of life. And the other is the Intro to Patient Safety and Medical Errors, which is an intro course in the whole field of patient safety.
Since 2017, you've served as president of Baltimore CONNECT. Would you be able to tell me about what Baltimore CONNECT is and how you got involved?
Baltimore CONNECT is a kind of a unique network or collaborative of community-based social service organizations, churches, neighborhood associations, mostly in East Baltimore. All of them are working to provide services and fill gaps for people who live in Baltimore. This piggybacked onto a grant from CMS to Johns Hopkins Hospital, but the grant that I obtained was from PCORI, and that was to create a community component to coordinate care for people in the hospital being discharged, and to coordinate primary care access and access to specialty care for people in the community who needed services.
What's the signature feature of Baltimore CONNECT?
An unusual feature, perhaps the signature feature of Baltimore CONNECT, is that the group meets on a weekly Zoom call on Thursday mornings from 9 to 10 a.m. Every week. And in fact, the group has met every week, with the exception of maybe a couple of holidays, since the beginning of the pandemic. When the pandemic started, many people realized that Baltimore CONNECT was an existing network, albeit one that wasn't particularly well funded, and came to us asking if we could help provide information to the community and also provide access to people living in the community for things that all of a sudden they needed due to problems created in access and services by the pandemic.
What's one of the Baltimore Connect projects you're proudest of?
Well, in the last 2 years, we've obtained real funding for the first time, grants that go to Baltimore CONNECT, Inc., the nonprofit, and not to Johns Hopkins. One from Quest Diagnostics Foundation allowed us to make re-grants to a dozen community organizations to promote youth engagement, mental health provision and access and information, and care coordination to people in the community. This has been running now for almost 2 years and has been a really, really terrific success.
When you're not working, what do you like to do to decompress?
I guess a couple of things. One thing which I try to do, I've begun to swim, which I do in a pool, indoors, just about every day of the year. I like listening to classical music and jazz, partly because I've got a musician in the family. And I read a lot. I don't know if writing blogs and manuscripts is leisure activity, but I enjoy it.
What do your parents and family think of your career path?
Well, my parents were always, especially my mother, was a little bit baffled about what I did in public health or quality of life or whatever that was. Her family were all diplomats. My father's side of the family were all scientists, basic scientists, and my grandmother was a little disappointed. My grandmother was a little disappointed that I did not get a PhD, but I think they were happy that I wound up in healthcare, and public health seemed close enough. I think what I do winds up being a little bit of a combination of diplomacy and science, so maybe things worked out okay in the end.
Nice. Do you have any book recommendations?
A book I've picked up recently and now can't put down is by John Koenig, called A Dictionary of Obscure Sorrows. And in it, he lists perhaps 100 key emotions that we all have, but which we can't really put into words because there's no word in English for that particular thought. One of the ideas might be that moment when you realize that the experience you're having right now is going to form a crucial memory for you in the future, and just having that realization. I can't remember all the words, but the ideas were really compelling.
What was one of the ideas you found most compelling?
I think one of the ideas basically is that we all have all of these emotions. We all have these feelings because we are humans. And maybe we don't name them because they're just below our consciousness. We might have them when we're half asleep, or maybe in our dreams, or maybe when we're daydreaming, not working, but doing something else that might help us get away from our work for just a minute. But those things really influence everything we do and influence how we've designed our whole civilization.
How have you been navigating this current funding climate?
I've been navigating with trepidation because I'm not sure where I should step or where I should not step, or if I should just pause for a minute. Fortunately, I've not been affected personally much yet. I think my general plan is to keep doing what I have been doing. I think the quality of life of people and patients in particular is going to continue to be of compelling interest to everyone. And I think everyone would like the care they receive to be safe every time. So I think that keeping on that course is probably also a safe approach. In addition, I've always had a pretty diversified funding portfolio, maybe because some of my ideas, at least initially, are a little bit out of the mainstream. I think that's not a bad plan. I'm currently funded by federal grants, but also by foundation grants, and some industries that one wouldn't think normally would be doing quality of life for patient safety research. But again, I think these things are pretty universal, and I think that for your personal finances and maybe for your research, keeping your options open makes sense.
Our last question is, what advice do you have for anyone who's interested in studying public health?
Oh, I would say do it. Early in my career, and maybe even still, I've been concerned about keeping options open, and public health gives you so many choices. Public health can lead you in lots of directions, and almost all of them are going to be satisfying. So I would say do it.